so this is actually chapters 1 through 3. Some of you have already seen this, but yesterday we talked about the first type, or the first part of words, the word root. It's the basic meaning of the word. Usually it tells the body part, and you cannot have a word root alone. You have to have like a prefix or a suffix on the end of a word root. The second part of the word is a suffix. It always, always, always goes at the end of the word. Most of the time, it tells the condition, the disorder, or the procedure that's going to be done. The third part of the word is the prefix that always, always, always is at the beginning of the word. Usually it indicates the location, time, the number, or the status. So when you put the word together, you add a vowel. Most of the time, you add it. You don't have to add a vowel, but most of the time, you do. It goes between the word root and the suffix, and it's there to make it easier to pronounce the word. Most of the time, and I know this is a test question, most of the time it's the letter O. Such as cardio, the O is the combining vowel. Then when you put the combining vowel with the word root, that becomes a combining form. Okay, so when the suffix begins with a consonant, you have to use a vowel. So for example, the word root is neuro, which means nerve, but when it is joined with the suffix plasty, which means surgical repair, plasty starts with a P, a consonant, so you have to put a vowel. So it's a neuroplasty, repair of a nerve. Make sense? Alright, so it's not a combining vowel is not used when the suffix already has a vowel. And they're even listed there in case you had a question on what a vowel was. So example, the neuro already has the O, so you don't, and you're going to add the suffix itis, you don't need that I, or I'm sorry, you don't need that O. So it's neuritis, inflammation of the nerve. Okay, itis means inflammation. So some rules when you join two word roots, you always use a vowel, such as gastroenterologist or gastroenterology, enteritis. Gastro, stomach, entero, small intestine. The suffix, which is spelled wrong, or the suffix, why is the E on there? Anyway, itis is a combining vowel, is not used because it ends with the I. Gastroenteritis, inflammation of the small stomach, where the small intestine is, more specifically. A prefix does not require a combining vowel. So, this is the third part of the word again, word root, suffix, prefix. Anytime you have a word, you always interpret the suffix first, then the prefix, then the word root. So that's why back here I was saying it's inflammation of the stomach, and more specifically the small intestine. So that's the itis is the inflammation, and then the prefix. No vowel is needed when you add a prefix to the word root. For example, cyano. Cyan means blue. Osis is the condition. Okay. We're going to do this for about a few more minutes. Erythro means red. You add the suffix cytes, and that means cell. So red cells, well, that's the red blood cells. Leuco means white. Melano means black.
So is leukemia like the loss of white blood cells?
It's not the loss. Anemia, God bless you. It's not a loss of them. It's a condition with Blue means it's telling you the white blood cells. Good question. Anybody else have a question? Poliomyelitis. Polio means gray, myel means spinal cord, and itis is inflammation. So this is inflammation of the spinal cord, specifically is gray matter of the spinal cord that can result in paralysis. You don't know about the paralysis. I mean, that word doesn't tell you that. All right, so here's some examples of suffixes. Suffixes again are added to the end. Hasn't this slide already been shown? Like, to me, this is a duplicate.
You wrote it on the board.
Well,
Why are there E's at the end of suffixes? Suffixes?
suffixes.
Yeah. Suffixes.
Suffix is plural, is singular. It's meaning one suffix. But talking about several suffixes, it's suffixes. It might be suffix I don't know.
Suffix sounds funny.
You know, like syllabus, syllabi. Anyway, tonsil completes the term what's happening in the tonsil. It tells you what's happening. We already know what a suffix is. So, ectomy means surgical removal. Some suffixes are nouns. A noun's a person, place, or thing. Crani is the word root, the So it tells you the cranium. Okay. Osis is abnormal condition. Pathology, LOGY is the study of. So this is the study of path, or what's going on with this, what's wrong with it. Algia means pain. So does dynia. Algia starts with a vowel. So if I said that gluteus, are you playing with your phone?
I was turning it on, actually.
Gluteus means what?
But.
So if I were to say gluteus algia, would that fit together?
No.
Why?
Because
It actually would. Because algia, algia is pain, and it starts with a vowel for that suffix.
Gluteus doesn't end with a vowel?
That's right. So Jessica Rue from Aurora Senior is a royal gluteus algia.
Yeah, I am.
Pain in the butt. Boy, that was so funny. You can watch the wheels turning. I finished. Yeah, I am. All right. How about gluteus dynia? Would that work?
No.
Not Claudia. She's leaving. Emily.
What?
Would that work? Gluteus dynia?
No, because there's no connecting vowel.
Combining vowel. That's right.
So I see a vowel at the end of it.
If you're adding a suffix that ends with a suffix that starts with a vowel, then you don't need to add a vowel. But gluteus ends with an S, and dynia starts with a consonant. So there's got to be a vowel between them. If you ended in neuro, ends with a vowel, so you wouldn't have to add one before the suffix. Okay? Malacia means softening. Osteomalacia is bone softening. Megaly is enlargement. You guys need to start learning what these words mean now. So megaly, enlargement. So hepato is liver. Hepatomegaly, an enlarged liver. Here are a few more that are related to pathology. Necrosis means dead, it died. And then sclerosis and stenosis are kind of similar looking. Sclerosis means it's a hardening. So arteriosclerosis, there's a hardening in the arteries. So, and you don't want that. It could be from plaque. It could be from some tissue in there, some cells. So you don't want that. You could have to go, the doc could have to go into an angioplasty. They go in through your genital area, but they go into a vein and then follow that vein up and go into your heart. Then they put some dye in there and take a picture or an x-ray, and they can see exactly where your vessels are. And they can see if you've got a blockage.
I thought you drank that stuff. That dye.
You can also drink it, and you can have a CAT scan. It's a different kind of a dye, and you can follow it. Okay, there's the esophagus, there's the stomach, and there's in the colon. Holy cow, you've got a big mass in the colon. Stenosis is a narrowing, so you can have a penile stenosis, which means that your urethra does not, it's got a stricture where it's too tight, so you can't put a Foley catheter up there to drain the bladder. Babies, I worked on babies that had a stricture or stenosis. They had a stenotic ureter, so that ureter was useless. So we had to go in and make a new one. Synthesis, that's a surgical puncture. They do an amniocentesis. Abdomino, it's amnio. I knew that this morning I said that doesn't sound right. That's not right. It's amniocentesis. So you can correct that on your slides. But it's where they go in when you're pregnant, take some fluid out from the placenta and around the baby, and they can test that and see if your baby's going to have trisomy 21. What's trisomy 21? Alejandra, did they ask you if you wanted to have your kid checked, your daughter, for Down syndrome? No? Well, around 18 weeks, they will ask if that you want to find out, you want to have an amniocentesis, and they can find out if your baby's going to have trisomy 21 or Down syndrome. I didn't have it done either because it didn't matter to me. If my daughter had it, well, that's not good. If she didn't, that's good. The thing is, I wouldn't have done anything. Most of the time, a parent does it. Well, if they're not going to have the baby. Well, I was going to have the baby even if they did. Anyway, ectomy means a surgical.
Trisomy 21 Down syndrome.
Yes. Ectomy means removal. So there's a few slides past this. Ectomy, otomy, and ostomy all look very similar. We'll point those out so you don't get them confused. Arteriography is where they go in and they can look at your arteries, see if you need to have some angioplasty done. Gram is also a picture. Plasty means surgical repair. So you have a rhinoplasty. Fix your nose. Myoplasty, myo's muscle. They go in and they fix the muscle. It's not a very good example to use. I thought I fixed it. Scopy means a visual exam. So you have an endoscopy. They go in and look at your internal, your inside. Go in through your mouth. Rage or ragia means excessive fluid. So you have a hemorrhage. That means your blood is bursting out. You could die of a hemorrhage very fast, bleed out. Or diarrhea is also excessive fluid discharge. Raphe means to suture or stitch it up. So myopathy, to suture a muscle. See, there's that myo that I was talking about for here, the myoplasty, repairing the muscle. All right, so that's where we're going to stop. And here's the diarrhea, the double R's. But we are going to stop here and get started on farm.